Welcome back to Bearcat Chats. And as we celebrate Black History Month here in February, a pleasure to be joined by Professor Titi Okoror. She's the chair and associate professor of Africana Studies here at Binghamton University. Titi, it's a pleasure to have you on.
Thank you, Jacob. It's really an honor to be here. Thank you.
Of course. Titi, let's talk about the upcoming event that you're a part of on February 24th from 1 to 3 p.m. Blacks and COVID-19 vaccines, harnessing the power of resilience against the legacy of medical racism. Tell me what you're looking to accomplish and how you're looking to inform people through this event.
Thank you very much. That's a good question. And so the idea for the event came out of a number of the things that have been going on in the Black community and things that I've observed. My training is in biobehavioral health. My specialization is global public health. And as a public health professional, I had to deal, part of what we deal with is health disparities and health equities. And so far now, the data is showing that Blacks are less likely to be vaccinated against COVID-19 in even places where they have access. And so the question has been, how can we get more Blacks involved? But the challenge with that thinking is the idea that there's a monolithic view of the Black community in America, this homogeneous group, which is far from the truth, which is, it's a huge community, but is highly heterogeneous. And so even though when we use the term Blacks, we're really talking about skin color at this point, forgetting the diversity in this population. And what I found out in my own research is the reasons why an African immigrant, for example, might not want to get vaccinated is not exactly the same reason why an African American might not want to get vaccinated. And so really the idea was to look at what strength the Black community as a whole had in common. And a primary one is the resilience of the Black community. And so really for this event, we're bringing together panels that have worked with these groups within the Black community. So these are professionals, these are professors that a lot of their work had either focused primarily on African immigrants and refugees or primarily on African Americans, acknowledging the diversity in the population to talk about what they are doing in addressing an increase in vaccine uptake. And so really, the goal is really to, one, inform people about what the vaccine is, but also move away from the deficit model. And when I say deficit model, it's the idea of constantly looking at the Black population as being the problem population, and forgetting the strengths within these communities in itself. When I talk about this with my students, I use an African adage. I'm from West Africa, Nigeria specifically. And we have a saying among the Southwest Nigerians, the Yorubas, that before the advent of the corn, the chicken was eating something. And really is a way of getting at what is there already that communities are doing that has allowed these communities to exist before the arrival of anything that may seem new to the community. And so really what has stood out to me and standing the test of time is the resilience of the Black community, either in the US or even in the continent. And so the population here are unique in their own way, although they are Blacks. And so our hope and our goal for the event is really to celebrate these differences, at the same time, pull on the resilience, the strength within these communities as a way of increasing and informing people about the uptake for the vaccine. So we really hope to get away from the deficit model. Blacks are not getting it, Blacks are more likely to be sick, Blacks are this and Blacks are that, to look at the strength within the community and how that has sustained the community and how that can be used to increase vaccine uptake in the community. So that's what we're hoping folks will take out of it.
And I really appreciate how there are distinguishing the different communities within the Black community. And so when I ask this question, I don't want to ask it as a broad sort of based question, but where have within the Black community, or where has the mistrust in the past come from that's led to this trepidation in some cases of the vaccine?
That's an excellent question. And I'm smiling because right now I'm part of a team of researchers looking at coronavirus pandemic among the African immigrants and African refugees in the US. And it's so funny you asked that question because it was one of the results that we've been finding in our study in this ongoing project. And so, and I was part of the study looking at African Americans. Now we're looking at African immigrants. And what is funny when you say that is when we look at the African Americans specifically, we're talking about people who had descendants of slaves in the United States. And when we look at them and COVID-19 and why they may be hesitant to get the vaccine, what we're finding out is the idea of the history, the legacy of what has been happening, of how Blacks have been used in experiments, starting with slavery up to some of the things that happen today. We do see that community memory, as it were, in wanting to avoid getting the vaccine. What is interesting, though, for the African immigrants, and so let me back up. So from our study for African Americans, we're finding that out to be the reason why they don't want to get the vaccine. And when we talk about science, usually is scientists have used us for research. So let them use themselves first. And if it works, we will get it. Which also explains why for the vaccine trials, there was push to get more Blacks involved in the trials, and it wasn't as successful as people wanted it to be. But what is funny is when for the African immigrants, from the research we're doing among this population, for these communities, when we talk about science, they believe in science. They see the value in science. They say, yes, let's go for it. However, when we say, okay, what about the vaccine, getting the vaccine shot, the pushback we're getting it, well, let them use it on themselves first. I'm Black. I don't want them to use me. What we're finding is that why African Americans can speak directly to the legacy of medical racism as a reason why they are reluctant to get vaccinated. What we're finding for the African immigrant is that they're pulling from the memory of the legacy, not necessarily because they've experienced it themselves, but because it's a legacy in the US that they can pull from to justify why they don't want the vaccine. So it's a very funny way of thinking about it, but which is also why is important for public health professionals. An effort to increase vaccine uptake must take a look at the community itself and the way they think about these issues to be able to talk about increasing vaccine among them. So why African immigrants believe in the power of science has been, yes, the vaccine is scientifically produced. Yes, let's go for it. We believe in the power of science. African Americans are like, wait, they've been using us a lot. We don't necessarily believe in the power of science the way you guys believe in the power of science, right? And so they're like, no, they've used us a lot. But for African immigrants, the pull is, well, they've used Blacks before. We don't want to be the Blacks they're going to use again, which is very interesting. So it's more of pulling from the community memory itself of African Americans to explain why they don't want the vaccine, why for African Americans, they have a direct memory in itself to explain why they don't have the vaccine. And these are two different issues. Even though the effect or the outcome is the same, the rationalization behind it is very different. And so in increasing it, we need to think from how the communities are seeing it, interpreting it, to effect the change we want, to effect the outcome we want.
So how do you go from the research, putting on your research cap, to saying, what are the dialogues we need to have to acknowledge the past history, but break through to say you're not being used?
Excellent question. So that's a very, very good question. How do we help people? But I think I love the way you said it. How do we acknowledge? And I think that's the point. How do we acknowledge the validity of these concerns, the validity of this history? Years ago, Professor Kume Inka, she was at University of Pennsylvania. I don't know whether she's still there right now. She wrote a piece. She wrote an editorial piece for the American Journal of Public Health, looking at the legacy of mistrust. And this was in the days of HIV/AIDS. And one of the points she made that I think is salient for us as public health professionals is that the assumption that is the Black community that bear the brunt of having to prove they trust the scientific community is backwards. The scientific community lost that privilege. They lost the trust. The burden of gaining trust back should not be on the Black community or African Americans specifically, but on the scientific community. And I think the first step in doing that is acknowledging the history. What is the impact of that history on the African American community, and not just is in the past, we've moved from there. No, we haven't. We haven't quite moved from there if the legacy of that is still being seen, but more importantly, if we're still having experiences of that today, then that means we haven't quite left that. That means we're still living with it. So that's what, acknowledging that history. And then for the African immigrant, for researchers to not just assume because they are Black, they are the same. And that's where, because that acknowledging that is essential to having the right dialogue, to understanding that the avenues or the mediums that may work for an African American community may not necessarily work for an African immigrant community. And that even within the African immigrant community, there's a huge diversity. So I think that's the first thing, acknowledging the legacy of that history is very important. And we as researchers need to understand this. And I say this all the time. We are there to support the community. We're not there to teach them.
Mm-hmm.
That is important. There's a line from a movie I watched years ago, Drumline. You know, the Nick Carter's character said, "No one can teach me to be me." And unfortunately, as researchers, we always wear this ad that we're going to teach community. We forget that that community was doing something, is doing something, which is why the community is still around. So we need to learn to be learners when we go into community, because by acknowledging that we don't know as much as the community know is the first step to us being willing to listen. And they'll tell us, and then they will tell us what would work. I don't have the answers, and I say that to my students all the time, but it starts with a dialogue. It starts with me acknowledging the legitimacy of what was done. It was done. It starts with me acknowledging the impact of that legitimacy right now on this moment in time. And it starts with me being willing to acknowledge the privilege I bring to the table and being willing to listen, to want to learn. Because there's another saying in Nigeria, I love the sayings. If you look intently enough, you can see your nose. And I've tried it, because if you look intently, you can see the tip of your nose. It's not any different. If we look intently enough and listen, the communities will tell us. So that's why the title of this webinar is The Power of Resilience. What are communities doing? How are communities doing it? How can we tap into that as public health professionals to engage the community, to empower the community, and to increase vaccine uptake? That's the goal.
Powerful words. As we wrap things up, tell me, for students that may be interested in attending the webinar, how they can access it. And I imagine this is not the only thing you're doing connected with this topic. Tell me what's upcoming.
Oh yeah, so we have another event in the department coming up in March, and it's around the issue, similar issue, but not specifically on COVID-19 or the vaccine. So in terms of students being able to access it, is actually on Dateline, is on the Beeline calendar. Also, the link is there. I believe the link is now on our departmental website, Africana Studies Department. They can also find that link there. So they can get the link through Dateline. I'm not sure whether students get Dateline, but it's also on Beeline. It's on the calendar, the university calendar, as an event taking place Wednesday, February 24th, from 1 to 3 p.m. Is when we have it scheduled. So, and they can also email me, tokoror@binghamton.edu. They can email me. I'm more than willing. I'm ready to share the information with them. We want a lot of them. We want students to be part of this. I see our students as the future. I'm not kidding you. I really see students as the future. I believe that if we learn to listen to each other more, sky's the limit. Sky's really the limit on how far we can go. Well, sky's no longer a limit because we have the space program, but sky's the limit on how far we can go, you know. So I really want our students to be involved. I see them as the future, but more importantly, I see them as having the agency to make the change we want to see. They just need the tools, and we can help them with the tools.
Well, Titi, you're inspiring them.
Thank you.
And thank you for talking with us about this terrific event, and really looking forward to attending and learning more.
Thank you. I will look forward to having everyone with us. We'll look forward to it. So thank you very much.